Good afternoon. Welcome to our webinar on managing chronic pain naturally. My name is Jamie Stagg with the Great Plains Quality Innovation Network. The Great Plains QIN is the Quality Innovation Network, quality improvement organization for Kansas, Nebraska, North Dakota, and South Dakota. I'd like to welcome and thank our audience for participation today. Today's webinar will be recorded and posted to our website, www.greatplainsqin.org. Please note it will take roughly 3 to 5 business days to be able to access the recording. Time pending, we will have questions after today's presentation. Please post any questions using the chat function on the bottom right side of the screen. We will be monitoring the chat feature throughout today's session. If we do not have time for questions, we will address them on our coaching call on January 29th. Today's presentation, along with other upcoming webinars, focuses on treatment of pain, one of the 5 pillars to address the opioid epidemic at a community level. Previous webinars have discussed take-back programs and prescription drug monitoring programs. Recordings of those are available on the Great Plains QIN website. Today's objectives are to describe non-pharmacologic therapies for managing chronic pain and to understand implementation strategies of non-pharmacologic therapies with patients for pain management. And in just a little context on the importance of non-pharmacological treatment in the management of pain. The CDC's guidelines for prescribing opioids for chronic pain, released last year, list non-pharmacological and non-opioid pharmacologic therapy as its first-line recommendation. These treatments should always be tried before opioids and should continue to be used in combination when a decision is made to start opioids. I'd like to introduce our speaker for today, Dr. Jane Murray from the Saskatoon Center for Integrative Healthcare in Overland Park, Kansas. Dr. Murray has more than 20 years' experience as a practitioner, medical educator, and mentor, author, and respected national speaker. She is dedicated to transforming healthcare from the inside out. Dr. Murray has served as Director of Education for the American Academy of Family Physicians, as the University of Kansas's Medical Center's Chair of the Department of Family Medicine, and she is currently a co-founder of the Saskatoon Center for Integrative Healthcare. Dr. Murray, I am turning the presentation over to you.
Thank you, Jamie, and welcome everybody. I know you're all from cold country this week. Maybe we get a couple days of warmth, but thanks for showing up. I think you're all very aware of the problem we've got with how many people in our country suffer from chronic pain, 100 million Americans, which is more than heart disease, cancer, and diabetes combined. So when we talk about chronic health issues, this is certainly a biggie. 50 million Americans take some kind of chronic pain medication. That is a lot. Let's see. There we go. And we're talking a little bit in this context of this series of lectures on the opioid epidemic. Very big. You're all very well aware of it. Even women in pregnancy are prescribed opioids. So, you know, it's a medical health care delivery problem. It's a social problem. It's a not knowing what else to do kind of problem that we practitioners often encounter. Lots of increases in treatment admissions for opioid overdoses and so forth. In America, we use all the hydrocodone that's produced and 80% of the oxycodone that's produced globally. So this isn't necessarily the same problem elsewhere. So pain is an unpleasant sensory and emotional experience, so sensory and emotional, arising from actual or potential tissue damage. You know, we typically think of pain as, well, you burn yourself, you hurt yourself, you broke an arm, you've got a tissue, something's wrong, and that's why you're in pain, which is really what acute pain is. We know what the cause of it is, the etiology. It's been present for less than 6 months, and we anticipate that it will be time limited. And we give, Advil and aspirin and heat and ice and sometimes other pain medicines if it's acute problems and surgery and so forth. But chronic pain is the problem that we're facing now in America, and that is pain more than 6 months in duration. What started it is from way back, and we might not even remember what it was, and it's certainly no longer a factor, and we don't see that there's going to be a time that it ends. So acute pain, of course, is a normal response to tissue damage. It goes away after the tissues heal. Our body is an amazing self-healing machine. That's what we do. We activate pain-sensing pathways and pain-relieving pathways. You put your hand on a hot stove. Ouch, that hurts. So you pull your hand away. It's a preservative, survival mechanism. We see with acute pain signs of faster heart rate, high blood pressure, sweating, those things that we call autonomic nervous system activities. We see that with acute pain. And usually acute pain responds well to pain medications and also non-pharmacologic therapies. Chronic pain, on the other hand, doesn't tell us, don't touch that. It's now a non-functional response that is a malfunction of the nociceptive or the perception of pain system in our nervous system. We don't usually see high blood pressure, fast heart rate, and sweating with chronic pain. Maybe with opioid withdrawal, but not with chronic pain. So now we've got a problem that's very complex, and you can sort of see how complicated it is in this slide. That, when you've got pain, you go to bed and you rest and you feel weak, and then you are not exercising and you have less energy and you're more tired, and then your sleep changes, and then you feel, like you're really not in your body, and you can have anger about this pain, and depression, of course, goes right along with chronic pain. And then you're seeing therapists and doctors and physical therapists and psychiatrists and all kinds of folks to help you with your pain, and many of them don't even believe you have pain, and that puts more stress on you. You don't stand quite right because something hurts, and so all of these things just keep reinforcing themselves. So intervening with this is the challenge. So of course our system perceives pain as a stress. Our adrenals go nuts. They send out cortisol and epinephrine, and we stop repairing our DNA because we're under stress. And interestingly, the pathways that sense pain as well as sense emotion or feel emotion kind of coincide anatomically in the brain. And so pain can cause depression, and being depressed can magnify the experience of pain. So in the cortex of the brain, the front part is thinking, memories, attention. What you feel as pain is going on in the cortex. The limbic system, which we're going to talk a little more about at the end, is where the ancient brain, right behind your eyes and nose, that's your rhinencephalon, the sort of reptilian brain where moods and instincts are fixated. We're supposed to survive, and so anything bad that happens to us gets fixed right in that limbic system, and it can trigger then depression, anxiety, irritability, even more pain perception. So breaking this cycle may take a number of strategies, but we can't stop it really even just with a pain medicine. If that were the best thing to do, it's not enough. So neuroplasticity is a word you may or may not be familiar with. It's the brain's ability to change. And we can change the brain in a bad way, and we can also change the brain, use its neuroplasticity abilities to change it in a beneficial way. So we get signals to the brain from the spinal cord, which is sensing all these pain perceptions. It undergoes changes in the neuron connections, which can permanently strengthen the reaction to the signals. So now you get these signals that tell you it's painful, even though under normal circumstances with a normal brain that hadn't been reinforced, you might not feel that. So that's maybe the key to the development of chronic pain, but it's also the key to reversing it. So we know the mind is really good at anything you teach it. That's neuroplasticity. So we have tremendous power to help healing, but we need training. So here are some things that would be considered non-pharmacologic approaches, but they do then train the brain to behave and sense things differently. Cognitive behavior therapy, very effective technique for chronic pain, anxiety, depression. Breathing techniques, we'll talk about the vagus nerve in a minute and why that is so helpful. Moving is actually really important to manage pain, even though people are afraid to move with pain. They think it's a message to not move. It's not a message to not move. It's a message that you've got to get yourself active. Being sure there's good sleep, and we'll talk a little about that. Yoga therapy, Tai Chi, Qigong, these systems that help the body have more flexibility and more neuroplasticity and control. Meditation and mindfulness have tons of evidence now for helping all kinds of health problems, and chronic pain is one of the ones that has been really looked at in terms of people feeling better with their pain, suffering less with their pain. Acupuncture, of course, for both acute and chronic pain of all different kinds, body work, massage, myofascial techniques, craniosacral therapy. These are all body work techniques that can release fascial tightness and muscle tension. And then there's many other techniques you may have heard of or participated in, Feldenkrais, Rolfing, Heller work, Traeger method, et cetera, et cetera. All of these things can have an effect on retraining the brain. Likewise, biofeedback, hypnosis, anything that reduces stress. So again, exercise is a stress reducer, but yoga, breathing, meditation, laughing, all of those things are stress reduction activities. We can look at people's neurotransmitters, and since they are made from amino acids, serotonin, dopamine, epinephrine, we can sometimes use very specific amino acids to get those neurotransmitters better. And we know serotonin, for example, is a big transmitter of pain messages. You can use nutrients, nutraceutical supplements to improve things like mitochondrial deficiencies. An anti-inflammatory diet we're going to talk a little bit about can really help pain that's resulting from any kind of inflammation. Balancing hormones, various psychotherapies, including those that have patients that have PTSD, which is not uncommon with chronic pain, fibromyalgia, chronic fatigue syndrome, and so forth. Music therapy is really being looked at and researched for improving people with all kinds of health problems, including chronic pain. There are herbal anti-inflammatories we're going to mention, saunas, infrared saunas that help relax muscles and detoxify and so forth, and then therapeutic touch and various energy therapies for which there's beginning to be more research, but still in the infancy. So we're talking now about integrative therapies, complementary therapies, and the number one reason people seek these things outside of the mainstream of medical care is their pain. So yoga, most people are familiar now with that, and you're starting to see lots of research articles about yoga for many, many health problems. Yoga therapy is an extension of yoga. It's another 1,000 hours of specialized training that yoga teachers who have a lot of experience can take and learn how to use yoga techniques, postures, breathing, mindfulness for specific health problems, which is fascinating. So I'm sorry this probably didn't quite come out right, but the yoga poses, or what are called asanas, can correct imbalances of the physical body. So we can learn, yoga therapists could look at someone, help them get their alignment better. This is about the vagus nerve. So the vagus nerve comes from the brainstem, and it innervates every organ in the thorax and the abdomen. So the heart, the esophagus, the lungs, the diaphragm, the stomach, the gut, the liver, all of your intestinal tract. And the vagus nerve is part of what we call the parasympathetic nervous system, which is the side of the nervous system that calms things down. So we have the sympathetic activating side, epinephrine, norepinephrine, fast heart rate, high blood pressure, able to run and sprint, fight or flight, and then the vagus side, the parasympathetic side, the rest and digest. So it turns out when you take deep breaths that move your diaphragm, you activate the vagus nerve, you stretch it, and therefore that then calms things down. This is why breathing techniques are so important for people with anxiety, high blood pressure, any kind of stress problem, and certainly for chronic pain. Acupuncture, most of you are probably familiar with, at least in theory. Little tiny needles, very thin, flexible, solid, not hollow needles that go into the muscles and the nervous system. And it's been looked at seriously over many decades now and found to have good evidence for lots of health problems, and particularly pain problems, like listed here. There's a Cochrane review, the big multidisciplinary evidence-based review system that says acupuncture can really be helpful for migraines if the person's willing to undergo this treatment. Some people don't like needles, but it can help definitely for migraines. And thinking about some natural substances, what we would call nutraceuticals or nutrients, magnesium is a muscle relaxant and can really help some people. Riboflavin and butterbur, feverfew, those are very good for migraine in particular. They have got good evidence for them. Coenzyme Q10 and turmeric you probably are familiar with as a good anti-inflammatory herb. So curcumin, turmeric, they're the same plant, that Indian herb that's yellow, really good for inflammation. Chiropractic has been looked at, and it's very helpful for acute back pain. Many randomized trials showing an improvement in pain with acute back pain and function. For chronic pain, however, not necessarily so much. The American College of Physicians just in the late part of 2017 came out with their statement about what should be used as first choices for patients with chronic low back pain. Non-pharmacologic treatment, as Jamie said at the beginning, exercise, rehab, acupuncture, mindfulness-based stress reduction, tai chi, yoga, etc. So all of those things that we mentioned a little bit earlier are now in the ACP guidelines for chronic low back pain. Fascia, that's probably a word that you're familiar with, the connective tissue that's the web of very thin connective tissue that brings everything together. It surrounds bone, muscle, blood vessels, nerves, and it's kind of one big giant sheath. And it's slidey, and so you can slide things across each other. That's why stuff doesn't get stuck when you move your arm. Your blood vessels don't get stuck on your muscles. You got fascia to make it smooth and slippery. But it can get stuck. It can get from multiple traumas, injuries. You bump it, you twist it, you bruise it. Well, the fascia may not completely heal. So it's like this whole spider web in our body. And if you pull one area, your shoulder gets hurt, your left hip can hurt because now the fascia's been pulled. And we often change our posture based on the fact something's out of whack. It's continuous throughout the body. It doesn't stop at an origin and an insertion like muscles. It's everywhere, and it's all connected. So it's a fascinating tissue. Let's see. I'm not doing this right. There we go. So nobody wants to be in pain. If we hurt, we don't stand the same way. We're trying to take pressure off of what hurts. We shorten our stride. We reduce our ability to reach because it hurts to reach, and so forth. And then we get less mobile because now we're not moving as much. It's sort of a cycle. We have postural distortion depending on where the pain is located. And we also see this compensation. So you hurt yourself on the right knee, and then your left shoulder is a problem because the fascia is pulling over that way. So the longer you have this compensation pattern present, the more likely your body's going to think that's normal, and therefore now you're not mobile, and now you're crooked, and now things hurt more in a different way. People with fibromyalgia, this is one of the more common chronic pain problems we see, and it's a little frustrating because we don't have like a blood test to diagnose it. But we think about people with fibro have to move. They have to have this energy bank concept where if they don't move, they're going to get stiff. Sometimes walking gently or water exercise is their best bet against no gravity. they can move and stay flexible. Getting adequate rest is good, though, too, because a lot of times these people feel really great one day and they do 12 things and then they're down in bed for days afterwards. So that's the energy bank concept, how much rest. Opioid receptors are blocked in fibromyalgia, so this is not a good approach for people with this kind of chronic pain. And I will say I've been guilty of this in my practice over the years at times of, let's do an opioid. Well, unfortunately, that is probably not a great idea. However, if we get some antidepressant effects, maybe that's why it's helping, but it generally isn't recommended. People with arthritis, which is another very common cause of chronic pain, they need to move. Water aerobics, water walking, swimming, yoga, Tai Chi, and Qigong have really been looked at for people with rheumatoid arthritis and osteoarthritis. So good evidence that those can help those conditions. Diet, I want to say a word about that because eating foods that are pro-inflammatory can create more pain. So inflammatory foods include sugar, red meat for some people, gluten, many of the grains. So if we can get people on an anti-inflammatory diet, it really does improve their health and their pain levels. So we want enough good essential fatty acids, fish oil, olive oil, nuts, and seeds. We want not to use margarine and snack food, trans fats and so forth. Dietary allergens that cause inflammation for people are common, especially those listed, wheat, corn, dairy, and red meat. For some people, coffee is a problem. Green tea is better. There's been some studies of vegan diets actually in rheumatoid arthritis, and people get tremendous relief of pain and inflammation, even inflammation markers. So diet's very important. Natural products and herbs, ginger can be helpful. Curcumin, turmeric, as we mentioned. Feverfew, especially for migraines, has some anti-inflammatory effect. And topical capsaicin, that's a black pepper extract that you can get as a topical gel or cream that can help in certain situations. Glucosamine is something we make in our body that helps build cartilage in joints. As we get older, we don't make this so well, and we don't have it in any food sources. So this is why older people tend to have a lot more joint problems because we aren't making it. Similarly for chondroitin, and not too many side effects of either glucosamine or chondroitin, and they both have evidence for helping mostly osteoarthritis. Acetylmethionine, SAMe, same thing. It helps it form that shock absorber activity in cartilage. Lots of evidence that people with osteoarthritis, particularly knee, hip, and spine, get benefit from SAMe. So you can sometimes find things that are glucosamine, chondroitin, and SAMe all in one product. Chronic pain, 50 to 80% of people with chronic pain have sleep difficulties because pain can interfere with sleep, and then if you don't sleep well and you're not resilient, your pain's worse. Lots of people with sleep apnea have more pain. They have lots of health problems. And if we give them opioids, which suppress the respiratory response, that's not a good thing. So we probably need to be assessing our chronic pain patients for sleep apnea, and that's very treatable. There's also other things besides drugs and CPAP machines that can help sleep. There's herbs, valerian, passion flower, all of those are somewhat relaxing, help sleep onset. Aromatherapy, lavender and sage tend to be relaxing for people. Benadryl has been recommended, melatonin for sleep, especially lower doses. We can get it in 0.31, 3, 5, 10 milligrams, but really more like 1 or 3 milligrams may be more effective than higher doses of that. Again, targeting amino acids to help your neurotransmitters, the relaxing GABA neurotransmitters, then things, the whole bedtime ritual, the not having lights and screens and so forth before bedtime. Emotional mind-body activities. This one's a study of rheumatoid arthritis patients who just did journaling about their past trauma, as opposed to the other people who didn't do that. They had almost a third of them decreased their rheumatoid symptoms just from doing a journaling exercise. Then these other things, hypnotherapy, guided imagery, biofeedback, breathing, meditation. You keep hearing this, but it's because it works. I like these two books a lot, particularly for people with chronic back pain, which is one of the more common chronic pain problems we see. John Sarno and Scott Brady have both written books about this, about suppressed anger, fear, anxiety, etc. Can, it gets shoved down. It's got to come out somehow. It doesn't go away, and so it comes out as chronic pain. And then we're afraid of moving. We don't exercise. We don't go do the things we love to do, play golf, play tennis, because we think, oh my gosh, it's going to hurt us. But that's really not helpful. You really have to move through the pain. And so for this emotional-based pain, which I think is more than we realize, pain medications aren't really the answer. Muscle relaxation, stretching, body work like we talked about, arnica, which is an herb that can be made into a gel or a lotion, valerian orally is a muscle relaxant, so there's some ways to get some help with those things. Interestingly, thinking about hormones, there's actually quite a bit of research in the rheumatologic literature about estrogen, progesterone, testosterone, and DHEA for people with particularly rheumatoid and other autoimmune arthritides, particularly people with low DHEA. Often those who are taking steroids, of course, are going to have their adrenal glands suppressed, so their DHEA is low. We give them a supplement of DHA to get them back into their normal physiologic level, and often their energy is much better, their pain's much better. So something to think about. Okay, I mentioned the limbic system, and so this is that ancient brain that sort of sits behind the eyes and nose that has the hippocampus, the hypothalamus, the amygdala, and the cingulate gyrus. And it is the instinctual fear center. So anything that comes into your environment and experience that's scary, that could be threatening to your survival, gets imprinted in that amygdala. It's permanent. Because you got to remember that so you don't die if it happens again. Nice, happy things, a pretty flower, a delicious berry, those things don't get imprinted there because you're not going to die from them. They're not a survival issue. So we're wired for fear, for survival. When this limbic system gets overstressed, too many messages come in that are fearful, are scary, are frightening. We keep activating the chemicals and hormones and the immune response of fight or flight. We don't detoxify things. We have reduced immunity to infections. We have hypersensitivity to pain. So I like that little on-off switch, this overactive limbic system now that's gotten too many whacks. Childhood abuse, bullying, shame and guilt, physical trauma, injuries, infections, surgeries, you name it, all these things that are threatening, now that switch gets stuck on. And now we can't function very well. And so there is this process that's fairly new called limbic rehabilitation. And for some people, this can be an absolute life-changing treatment. It's kind of like cognitive therapy on steroids focused at the limbic system. So there's a couple of resources there that I would recommend. We have to know our purpose in life. I don't think I'll take the minute to read this, but I think it'll be in the handouts that you have. But basically, we spend all this time, having more details, having more data, having more information, and less on interacting with each other and having quality experiences in our life. So meaning and purpose is really important. Why do we want to get well? Why do we want to work through our chronic pain, eat differently, meditate, move when it hurts? Why would we want to do all that stuff to get better? We've got to have a reason. How do we find our essence? How do we live from a deep place in spite of pain? So this is really important to suffering less. Not so much, the pain's going to completely be gone, but how do we live with it? And Friedrich Nietzsche, not necessarily my favorite person to quote, but I love this. He who has a why for life can put up with almost any how. There's a reason we get up in the morning, we can do it. And this is so true. Pain is inevitable. We're all going to have pain. We decide to suffer or not. So, and remember, one of the stress-relieving things can be humor. So here's a favorite cartoon. The mind-body problem. Get up. No. How often we feel, right? Go exercise. No. Meditate. No. Go eat some vegetables. No. We got to get our brain and our body working together. Now, I hope you can see this. Look around. Reasons to smile are everywhere. See that little imprint through the lady's yellow dress? I just get a kick out of that one. We got to find reasons to smile, right? And laugh. Laugh out loud. So there's my contact information, and I know we are going to have another coaching session on January 29th. I don't know, Jamie, if we have a couple minutes for questions. I'll throw this back to you and see what's happening. Thank you so much, you guys.
Thank you, Dr. Murray, for your presentation. We are running a little long here, so I'll ask if anyone has questions to please enter them in chat. We did have one inquiry for a little more information regarding feverfew. If you could provide a little additional background on the use of that.
Okay, so feverfew, berberine, riboflavin, all those have some evidence, particularly for migraine. I'm frantically trying to think of the dose of feverfew, but there are some products on the market you can get at health food stores. Typically, it's usually about 100 milligrams a day of feverfew extract, often combined then with berberine and riboflavin.
And I'm just, you did a great job of providing us with all these options that are available. You know, when you're managing someone's pain, where do you start? I think that might be a question.
Yeah. Well, you know, that's always the best question because there's lots of options. Many of them cost some money. Yoga classes, yoga therapists, acupuncture, they cost money, often not insurance covered. But breathing and meditation are free. And there's lots of online resources for meditation apps. There's one I like called headspace.com that's really good for getting people into a 10-minute meditation every day. And that can help anybody. All of us in health professions who are stressed out, we need this too. I talk to the patient, you know, here's some things that I think could help you. What are you interested in? What are you willing to do? What do you feel like is possible? And, you know, let them kind of be the guide of, do you want to try some anti-inflammatories? Would you be willing to change your diet? You know, and it's all of these things with lifestyle, you know, we feel like, oh gosh, they take so long to explain and it's a lot of teaching time. The diet thing doesn't have to be complicated or difficult. I mean, it's really no sugar, no dairy, no gluten, lots of vegetables. There's your diet plan. Now, implementing that is certainly more difficult, but there's lots and lots of books now and cookbooks, anti-inflammatory cookbooks and eating plans out because this is very big around the country. So I guess you have to start where the patient is. What they feel like what are their goals? What can they do? What can they afford? What's their motivation?
Yeah, excellent. The app was Headspace. I just want to confirm that.
Yes.
Question.
HEADSPACE, all one word, .com.
Thank you. And I want to remind everyone that a recording and a copy of the slides will be available on our website in about 3 to 5 business days. We had a few formatting issues with a couple of the slides I noticed. We'll make sure that that's corrected on the version we post to our website. If you have additional questions after reviewing the handouts and the recordings, I encourage you to join us on January 29th when we will have a coaching call with Dr. Murray rejoining us. And that's really the purpose of that call is really to answer your questions. If you're having challenges, if you have successes you want to share, that this is your opportunity for that. It's a very interactive call. And then also want to highlight that in February we'll be talking about chronic pain management at a family medicine residency clinic. And in March, we look forward to learning about some statewide efforts to provide some guidance on pain. Dr. Murray had her contact information on the slide, and here's contact information for our medication safety leads. Feel free to contact us with any questions as well, and we can follow up on those with you. We ask you to complete the evaluation form from today's event, which will open when you close out of the WebEx here today. Thank you to all of you for your participation today, and a big thanks to Dr. Murray for speaking. We hope you found this information valuable and applicable. This concludes our webinar. Thank you, everyone.